Vitamin A. Do we really need it? Vitamin A is a fat-soluble vitamin that's essential to our good health. It's used for a variety of growth and healing purposes in the body. In fact, close to 700,000 children never live to see their 5th birthday every year because they don't get enough vitamin A, retinol, in their diet. Severe deficiencies are less common in developed countries, but still occur due to poor diet lacking in the healthy fatty food, like fish and animal livers and eggs that contain it. The body can also make vitamin A using dietary carotenoids that come from leafy greens and colorful vegetables, but they're not converted very effectively, meaning that even a healthy vegetarian diet that's high in leafy greens and carotenoid-rich veggies puts you at great risk of vitamin A deficiency and its many negative side effects on your health. What is vitamin A? Vitamin A is needed for the growth and development of every cell in our body. It's also essential for good vision, bone growth, and regulation, immune system function, gene expression, skin health, blood cell maintenance called hematopoiesis, and the development of fetuses in pregnant mothers. Vitamin A can be split into 2 different groups that include the vitamin itself, found in animal fat, and a group of several provitamins. Retinol. This form of the vitamin is easily absorbed and ready to use by the body. It's important to read vitamin labels to identify whether you're consuming ready-made retinol or a provitamin that can be used to make it in the body. Always stick to the dietary guidelines recommended for your age group or condition to avoid symptoms of too much called hypervitaminosis A. Provitamins, beta-carotene, alpha-carotene, and beta-cryptothaxin. All herbivores and omnivores can convert these provitamin A carotenoids into vitamin A in the absence of ready-to-use animal and fish sources. These fat-soluble provitamins are abundant in colorful fruits and vegetables. They also act as antioxidants throughout the body, and due to their low rate of conversion to vitamin A, there is no danger from consuming excessive provitamin A carotenoids. There are also synthetic forms of retinol. The most common brand names you'll find are Retin A, tretinoin, and Accutane isotretinoin. Both are commonly prescribed for persistent acne that's shown to be resistant to all other forms of treatment. However, Retin A is also often used in age-defying serums and creams, and has also been used to treat acute promyelocytic leukemia. Health benefits of vitamin A. Eye health. The light-sensing layer of our eyes, called the retina, uses retinol, vitamin A, combined with 2 specific proteins, opsin and rhodopsin, to help us see in low-light conditions, and is also crucial for the eye's ability to differentiate between different colors. Vitamin A also helps to keep our eyes moist. Dry eyes and/or poor night vision are early warning signs of deficiency. Strong teeth and bones. Vitamin A is used in the formation of the dentin and marrow inside our teeth and bones. It also works hand in hand with vitamin D to help regulate calcium levels in the bones to prevent it from leaching out. The balance between vitamins A and D in the body are crucial, though, and too much A without enough D for long periods can cause osteoporosis and hip fractures. Strengthens immune system. Vitamin A helps to form the lymphocytes in our immune system before we're born. Children born with low levels of vitamin A because of a malnourished mother often have lifelong problems fighting off infection, even if the deficiency is detected and treated right after birth. After birth, vitamin A is used in the formation of epithelial tissue, monocytes, macrophages, NK cells, neutrophils, T and B lymphocytes, and T cell production, T and B cell production, and more. Silky smooth, youthful skin. Some vitamin A that we consume is converted into retinoic acid. Retinoic acid tells our immature skin cells, called keratinocytes, to mature into epidermal and dermal cells. This is not only essential for maintaining an essential glow and elasticity to the skin, but also for propagating the healing process when we're cut or scratched. Applied topically, vitamin A helps to treat a variety of skin conditions like eczema and psoriasis by speeding up the turnover of skin cells. Effective acne treatment. Because of its ability to increase the speed at which skin cells mature, vitamin A taken internally and/or applied externally is one of the best acne treatments available. There are few prescription-only treatments for acne that use synthetic vitamin A, Retin A, or Accutane. People with persistent acne who don't care for the over-drying effects that these medications cause often turn to natural vitamin A supplements and creams and have great success with them. Antioxidant benefits. Vitamin A is used in the body to fight free radicals from oxidizing our tissues and causing premature aging. It's also used in the blood to fight oxidation of triglycerides and LDL cholesterol, both of which lead to narrowing of the arteries and heart disease. Cancer fighting. There's a primary link between uncontrolled oxidation and cancer, meaning adequate intake of this vitamin offers anti-cancer benefits. Healthier babies. Due to all its functions in helping bones to grow, the formation and maintenance of the immune system, the formation and maintenance of the eyes, the formation and maintenance of the skin, and so forth. Adequate intake of this vitamin is critical for pregnant mothers who want to ensure their baby is born in good health. Read the section on deficiencies further down the page to learn more about the dangers to children who don't get enough. How much vitamin A should you take every day? Children, 1 year. RDA, 500 microgram. 20,000 international unit. Safe limit, 600 microgram, 24,000 international unit. 1 to 3 years, RDA, 300 microgram, 12,000 international unit. Safe limit, 600 microgram, 24,000 international unit. 4 to 8 years, RDA, 400 microgram, 16,000 international unit. Safe limit, 900 microgram, 36,000 international unit. Males, 9 to 13, RDA, 600 microgram, 24,000 international unit. Safe limit, 17,000 microgram, 68,000 international unit. 14 to 70 years, RDA, 700 microgram, 28,000 international unit. Safe limit, 3,000 microgram, 120,000 international unit. Females, 9 to 13, RDA, 600 microgram, 24,000 international unit. Safe limit, 1,700 microgram, 68,000 international unit. 14 to 70, RDA, 700 microgram, 28,000 international unit. Safe limit, 3,000 microgram, 120,000 international unit. Pregnant, RDA, 750 microgram, 30,000 international unit. Safe limit, 3,000 microgram, 120,000 international unit. Breastfeeding, RDA, 1,200 microgram, 48,000 international unit. Safe limit, 3,000 microgram, 120,000 international unit. Warning about hypervitaminosis A. The safe limit listed in the table shouldn't be ignored. In fact, it's important to carefully adhere to the maximum daily dosages for all fat-soluble vitamins, since they accumulate and are held in the body and aren't flushed out as quickly as water-soluble vitamins like vitamin C. Consuming as little as 15,000 UG daily can cause symptoms of hypervitaminosis A to occur, including insomnia, irritability, diarrhea, fever, anemia, bone fractures, hair loss, nausea, headaches, blurred vision, weight loss, drowsiness, muscle weakness, and changes in your psychological well-being and others. Consuming doses beyond 120,000 microgram can lead to many of the symptoms mentioned above to become life-threatening if levels in the body aren't lowered quickly. Hypervitaminosis A isn't a concern if you're applying this vitamin topically using a cream, lotion, or serum. Note about severe vitamin A deficiencies. With vitamin A, it should be obvious that too much is definitely not a good thing. However, due to poor diets, high in processed food and sugar-laden treats, and not enough quality animal and vegetable sources, deficiencies still exist. In fact, it's estimated that a severe vitamin A deficiency of close to 700,000 children under the age of 5 every year, with another 250,000 to 500,000 children in underdeveloped countries going blind in that same time frame due to deficiencies. Night blindness is usually the first symptom to develop when you've become seriously depleted, with eventual blindness sure to follow if the deficiency isn't corrected in time. A severe lack of this vitamin also leads to reduced immune system function, poor bone density, diminished resistance to cancer cells, and a host of birth defects when pregnant mothers fail to get adequate doses. Conclusion: as you've hopefully gathered after reading all the information we've laid out for you, vitamin A supplementation isn't something that everyone needs to do. While it's perfectly fine for anyone to use a vitamin A cream, lotion, or age-defying serum, taking vitamin A supplements internally is something that needs to be done with care. If you've had blood tests that confirm you or a loved one are deficient, follow your doctor's dosage recommendations. They'll usually recommend you use a supplement that offers a large dose close to the upper tolerable limit for a set time, before scaling back to the RDA dosage. If you eat plenty of animal sources, like animal livers and eggs, choose a vitamin A supplement that offers a low dose, which doesn't exceed the RDA for your age or lifestyle group. Thanks for stopping in, and please don't hesitate to share us with your friends and bookmark the site for future reference.